Hello everyone, welcome to my channel. It's InfoTuber. In today's video, I am going to briefly explain about the bone clavicle. In each video, I will explain the humerus, radius, scapula, ulna, carpals, metacarpals, etc. But in today's video, I am explaining about the clavicle. Please don't forget to subscribe, like and share to your friends. In further videos, I am going to upload the next bones, and you also can comment below your query and I will definitely answer you. And also comment that what type of videos you do like to watch from my channel more and more. While I'm explaining, please keep your BD Chaurasia text near you and observe the points. Skeletal system, upper limb. In upper limb, there are 64 bones, in which each side 32. Right side 32 bones are present and left side 32 bones are present. 32 plus 32 total 64 bones in upper limb. This is a clavicle. This is the largest bone, lies horizontal in our body. It is subcutaneous. This is the first bone to start ossifying. It is the only a bone that ossifies in membrane. It has a two primary center of ossification and one secondary center. There is no medullary cavity in this bone. Okay. This bone is anatomically divided into three parts, that is shaft, medial end and lateral end. Lateral end is flat, medial end is quite large and quadrilateral. Let's come to the features of this bone. The shaft is cylindrical and slightly curved, in which when we hold this bone properly, it is convex forward and concave forward. Okay, this is the right posture to hold this clavicle bone. It is a convex forward and concave forward. Medial part is concave, lateral part is convex. Medial two-third have a four surfaces and it is round. The medial two-third is four surfaces and it is like a round and cylindrical structure. It have a four surface, that is anterior, posterior, superior and inferior. Okay. Anterior surface is convex forward. You know that anterior surface is convex forward. Posterior surface is quite smooth. You can feel that smooth. There is no ridge or a groove, nothing. It is a smooth. When we come to the superior and inferior, it is rough. It's quite rough. When you touch the superior part and inferior part, it is rough. Next, let's come to the lateral one-third of the shaft. Lateral one-third is quite flat. It have two borders and two surfaces. Two borders are anterior border, posterior border. Surfaces are superior surface, inferior surface. Anterior border, you know that it is a concave forward. Okay, anterior border is concave forward. Posterior border is convex backward. Posterior border is convex backward. Superior is a subcutaneous. It is near to the skin. You can feel in your body this part of the clavicle. Superior is a subcutaneous. Inferior surface have an elevation. That elevation is called conite tubercle and it is a ridge. Can you see that? Here there is an elevation. It's a ridge. Ridge is a trapezoid ridge. Okay, trapezoid ridge. Lateral half of the surface have a longitudinal subclavian groove. You can see and you can feel that groove. And The medial end articulates with the manubrium of sterni. This joint is called sternoclavicular joint. Sternoclavicular joint with a notch of manubrium sterni. You know that a sternum have a manubrium sterni. It articulates with the manubrium sterni by forming a joint called sternoclavicular joint. Then the lateral end articulates with the scapula. The lateral end articulates with the scapula by forming acromion clavicular joint. There is an acromion clavicular joint with the scapula with the lateral end of the clavicle. Now we have ended with the features. Let us come to the attachments with this bone. Let's start from the lateral end. You know that the margin articular surface, this margin is called articular surface. You know that the acromion clavicular joint is formed at the lateral end. You can add this point under the attachment topic. Then let's come to the medial end. Lateral end is over. Let's come to the medial end. Okay. You know that again the margin of articular surface articulate with the manubrium of sterni by forming sternoclavicular joint. And one thing, the 3 extra points here is added in attachment. The fibrous capsule of sternoclavicular joint all around the fibrous capsule of sternoclavicular joint. Then articular disc posterior superiorly. Here the posterior superior, you can feel that the articular disc. Interclavicular ligament superior. At the superior, the interclavicular ligament is attached to this bone. Okay, this is the simple and easiest bone. In Viva, they will twist and ask many questions. Next, let's come to the lateral 1/3 of the shaft. Lateral 1/3 of the shaft, at anterior border, there is the origin of deltoid muscle. 1/3 of the lateral of the shaft, anterior border give origin to the deltoid muscle. Posterior border give insertion to the trapezius. And you know that the conoid tubercle and trapezius ridge. Here the conoid tubercle, you can feel a depression here, that is called conoid tubercle, and you can feel the ridge, that is called trapezius ridge. In coracoclavicular ligament, there is a conoid and trapezoid part. To that part of a coracoclavicular ligament, this conoid tubercle and trapezoid ridge give attachments. Understood? There is no confusion. There is a conoid and trapezoid part in coracoclavicular ligament. Okay, so in coracoclavicular ligament, conoid and trapezoid parts are attached to the conoid, tubercle and trapezoid ridge respectively. Okay, let's come to the medial 2/3 of the shaft. At anterior, the origin of pectoralis major, and posterior, close to the medial end, origin of sternohyoid muscle. Pectoralis major, sternohyoid muscle. Here deltoid muscle, trapezius, insertion of trapezius muscle, pectoralis major, and origin of sternohyoid muscle. Simple, here to here to. Next, come to the superior and inferior. Superior, origin to the clavicular head to the sternocleidomastoid. Okay, origin here, the superior surface give origin to the sternocleidomastoid, and inferior give attachment to the costoclavicular ligament. Sternocleidomastoid, costoclavicular ligament. Okay, sternocleidomastoid, costoclavicular ligament. There is a subclavian groove give insertion to the subclavian muscle. The margin of groove give attachment to the clavipectoral fascia. I think you know about the fascia, the margin of the groove, the margin of the subclavian groove give attachment to the clavipectoral fascia. Then subclavian vessels and cord of brachia. Plexus pass toward the axil like between inferior surface of a clavicle and upper surface of the first ridge. The nutrient foramen transmits a branch of the suprascapular artery. Nutrient foramen, you can see the nutrient foramen. Nutrient foramen transmits a branch of the suprascapular artery. Okay, this is the easiest. You know that there is no confusion, I think. The two muscles here, deltoid and trapezius, pectoralis major and sternoid muscle. And again at the superior and inferior, sternocleidomastoid, costoclavicular ligament. That's it. Other than that, the features, everything is easy. So remember that it is a concave forward and convex forward. So this articulates with the manubrium sterni and this articulates with the acromion clavicular joint with the scapula. So the right position to hold this bone is like this. So this is a right side bone. Which side of the body? This is a right side of the body. This clavicle is present. Left side of the body is totally opposite, that is this and medial end will come this side and the lateral end will go that side. Two articulates with scapula and sternum, and the convex and concavity will changes. This is the right side bone of the body. In Viva they will ask, hold and show how this bone situates and which side this bone is. Like that they will ask. You have to hold like this and you have to hold to your shoulder and you should show that this bone is present in this position in our body. Next, ossification. I have said that this is the only a bone which ossify in the membrane. It has a two primary center of ossification and one secondary center of ossification. There is no medullary cavity. Remember that it's a viva. In viva they will confuse and they will twist the question and will ask. There is no medullary cavity in clavicle. Okay, the primary ossify center appears in shaft between 5th and 6th week of the embryo. It fuses this 5th and it fuses with the bone at our 45th day. Okay, the primary ossifying center appears in shaft between 6th and 5th week of the embryo. It fuses about the 45th day. Next, the secondary ossifying center appear towards the medial end during 15th and 17th years. It fuses with shaft during 21st and 22nd years. Occasionally, there may be the secondary center for acromial end. So, secondary center provides the acromial end. Okay, let's come to the clinical anatomy. The clavicle is commonly fractured by falling on the outstretched hand. The most common site of fracture is the junction between the two curvature of the bone, which is the weakest point. The lateral fragment is displaced downward by the weight of the limb as a trapezius muscle alone is unable to support the weight of the upper limb. The clavicles may be a congenital absent or imperfectly developed in the deceased called cleidocranial dystosis. In this condition, the shoulders droop and can be approximate anteriorly in front of the chest. Thanks for watching. Please don't forget to subscribe, share and comment.